Hydroxychloroquine. The hydroxychloroquine, I don't know, it's looking like it's having some good results.
The drugs are not approved for coronavirus right now. Chloroquine originally came to the market in the 1930s to treat malaria, and about 20 years later, hydroxychloroquine, the one that's caught the president's attention, came to market and has largely been used since then to treat lupus and arthritis. There isn't much evidence right now for it against coronavirus. The data are mixed so far. Some early studies have suggested that hydroxychloroquine can help speed up recovery in patients that have mild symptoms, but that's early and small studies. One of them has since been questioned by researchers. Other studies suggest there actually is no benefit at all. There's a very big study ongoing in New York right now, but that's going to take weeks, if not months. No drug is without risks. One of the things the president has been saying on the press briefing stage is that what is good about this drug is that since it's already approved for other conditions, we know that it's safe. That's not necessarily true. Every drug comes with its own risks. For hydroxychloroquine in particular, you have to worry about it worsening heart conditions. It also doesn't interact well with certain diabetes medicines, and there's some toxicity concerns there too. There have already been some shortages of this medicine. It's been used for years by patients with lupus and rheumatoid arthritis to suppress flare-ups of their diseases. And right now they're reporting nationwide that they've had a hard time getting access to their prescriptions. Some shortages have already been reported to the FDA and they're working on that. But for now, the hype has caused prescriptions to go up as much as 7,000% in March. And that's causing problems. A lot of doctors are really worried about what the unintended consequences will be because this is now the new thing. There's worry that chloroquine craze could crowd out other clinical trials. So there are lots of medicines right now in the pipeline that people hope could cure coronavirus. Some of them have never been used before. There's concern amongst researchers that if there's a drug that's readily available from your doctor right now, that somebody could be more tempted to get that medicine rather than enrolling in a clinical trial when it's clinical trials that we rely on for solid answers about these things. Getting access is not some sort of either or situation. So just because we are emphasizing clinical trials right now and health officials are saying that that's the most important thing to get answers does not mean that someone is not going to be able to get access to a medicine that they want to use. One way that we know that this works is that in the ongoing Ebola outbreak, they tested a range of potential therapies at the same time. And when they figured out during the course of those trials that two were actually way more effective than other ones, they switched those trials so that everybody got access to the best care. So there are ways that we can ensure that everybody still gets the best options, and it doesn't mean that you have to go through this off-label use that could actually extend the time for these answers.